Hello, Dr. Shaurya. I'm Dr. Harpreet Singh and I represent Team Conceptual Orthopedics. Beta, please tell your parents' name and what do they do?
Sir, my father's name is Sushil Kumar Srivastav,
Hmm.
and he is in the pharmaceutical business.
Okay.
And my mother's name is Pallavi Srivastav, and she's also a housewife as well as she helps my father in the pharmaceutical business as well.
Okay. So your parents must be proud that you are now a licensed orthopedic surgeon. And congratulations on passing your practical exam of orthopedics.
Thank you, sir. Thank you so much, sir.
So tell me something about your journey as a doctor, Dr. Shaurya.
Sir, I have done my MBBS from King George Medical University, Lucknow, and I started doing it in 2014, and before that, I was not very sure of of becoming a doctor as such, but I had my own reasons. I thought I would be serving people in some way, so I took this profession as a way of serving people. But then again, I was not very much interested in doing as a taking medicine as a profession. But then I realized that this was my calling, and I was very happy doing it when I came into it. And after that, when I finished my UG and during my internship, I realized that my actual calling is orthopedics. And because I used to go there for my postings, and I really liked the way that orthopedic surgeons used to work, the way they used to handle patients, the way they used to make them walk quickly. So I like that part of profession, and I was not one to pick medicine as such. So I did not. I was not my inclination going towards medicine. So and then I gave my NEET PG exam. First NEET PG attempt I gave during my internship, and I was not very much successful in that. I had around I think it was around 20,000 something. I scored in the 20,000 rank I got in all India NEET PG exam. And after that, I gave my second attempt. I took a drop that year. I gave my second attempt, and then I scored around 12,000 ranks in the NEET PG. And then I got a civil hospital, Panchkula. I have done my DNB from civil hospital, Panchkula, sir. So during my DNB days, I fell in love with orthopedics as like much more than was anticipated before.
Okay. So tell me how has the team Conceptual Orthopedics been of help to you during your journey as an orthopedic surgeon?
So, sir, I was introduced to conceptual orthopedics in my first year. My seniors were there, so they told me that you should get conceptual orthopedics because it is very easy platform for you to learn. You will keep on once you get to see something in the ward, once you get to see something in the OPD, it is very easy for you to go back and just search on the Conceptual Orthopedics app, and then you will get a video or get a notes of that, and you will be very easily you will be able to read it. Because at that time in first year, I was very confused of what sort of books should we buy at that time. So before even buying the books, before even buying the Campbell or Rockwood, I got my e-Conceptual Orthopedics subscription done within the first year only. So from everything like the ward rounds, what Dhal sir has like taught us during the ward rounds video, or the small the trauma surgery videos that Shailesh Bhai sir has given. So all of those surgery videos before the going to the OT next day, or even if I was not going to the OT next day, even if I had admitted that case that very day, so I would go back and just open that video, small video about what are the IT fractures, what are the like femur fractures, and later that I'll have to consult the books as well. Like just going through the videos will not help me completely because all the videos that I used to see, I never used to make any notes out of them. So later when I got the notes of conceptual orthopedics and those 5 6 books that I got from conceptual orthopedics, I used to whatever used to read or whatever I used to watch in the videos, I used to add on to those notes as well, or in the same textbook. So that was a very big help for me. And During my preparation days, when I was preparing for the final exam, final theory exam also, I was like consulting COPG's last year questions that were given in the COPG app, and everything that was there in the conceptual orthopedics, like the previous year questions, like the small pearls that were there. Before sleeping, I would just scroll on and see some 10-15 pearls before sleeping. So keep on remembering all those pearls. So like that, I prepared for theory exam. And then after passing on to theory, when it came to practical exams, sir, so I also the conceptual orthopedics have like they gave me a few courses that I attended. In the second year only, I attended the conceptual orthopedics PG course, the 3-day PG course, sir. After that, I've also attended the COPG trauma course that was given, the basic trauma course that was given to us. And also I attended in the like after passing my theory exam, the COPG OSCE course was given, so I attended that as well. So it was a huge help for me. So just because of that course, I understood how much I lacked behind in understanding OSCEs, and because of that course, I was able to read so much just before going through the practical examinations.
Okay.
So conceptual orthopedics has been a huge help, sir.
Okay. So, but a guide or a mentor can just hold your hand. The main hard work comes from the student. So, again, congratulations. And what have you
Thank you so
decided
much, sir.
for your future? What are you thinking? How are you planning your future?
So right now I'm working as a senior resident in AIIMS Raebareli.
Okay.
So most probably I was like before this, I was not having any set plan of where I'm going to be. But now I'm thinking that I want to go into academics. After that, I've studied so much during the preparation days, and also I see the conceptual orthopedics faculty that I have, that they represent such good institutions and they represent such good academics, and they have all very good academicians. So they inspire me a lot, sir. So I want to be like one of those people. So I would really love to go into academics, towards academics only, sir.
We see a future Dr. Dhar in you. Uh, and what would you tell your juniors and your colleagues? How should they go about their career or during their residency days? Should they prepare for the exams? Any tips and tricks from your side?
Sir, first of all, I'm no one to give any tips and tricks to any of those juniors who are trying to prepare anything for like prepare for the exam. I can only tell one small thing, that during the practical, firstly, I was too much focused on uh, how to examine a patient and how to be very much. I should be doing examination very properly. I should be presenting my case very properly. So, although we do very much of case presentations during our 3 year of PG course, in the final exam, the case presentations matters very less according to me, sir. In fact, I have seen that even if you give a very bad case presentation during your practical exam, the examiner would not mark you very less. You can cover all those marks during your ward rounds, table vivas, and most importantly during OSCEs. So I was much focused towards OSCE and a little less focused towards the clinical presentations and case presentations. Although it was not bad for me, the case presentations that I did was also not very bad. They went very good, sir. But I think people like students try to focus more towards case presentations, and that part should be better rather than focusing more on the OSCE part. So sometimes people score a little bit lesser on the OSCE side, and I think OSCE is one tool that helps you pass the exam, sir.
So good suggestion that there are three parts of the exam, the especially the DNB exam we are talking about. So one third is your case presentation, one third is your OSCE, and one third is your ward rounds and table viva. And
Yes, sir.
each of these would require equal amount of time, focus, and hard work. And I think
Absolutely.
if the students and your juniors go by the advice you have given you, they'll be helped a lot. Uh, thank you, Shaurya. Thank you for giving your time. I am really honored that you are part of your journey and will continue to be a part of your journey. And we welcome you to our
Yes, sir.
conceptual orthopedics family. Thank you, Shaurya, and all
Thank you
the
so much.
best for your future.
Thank you so much, sir.